So I remember I had hardly no money because my ex had not given me any money, and I had to sell almost 80% maybe of everything I owned in order to survive. He didn't give me anything. But I remember sitting in Otani's, getting ready to take my children into a restaurant, and I called my bank, and I said, listen, all of a sudden there's a bunch of money in there. And they go, well, miss, it looks like it's a government check. Social Security never even told me I got approved. They just put the money in the bank, and I got the letter maybe a month later. So yeah, it went back retroactive from the date I applied, okay? So keep that in mind. It took 2 years for my little sister to get approved because she changed her name. And my other sister who got disability, I did all her paperwork, not online, but just sitting in my living room filling out the paperwork. They want to know your pain level, like if you're hanging up clothes or if you're doing housework or loading the dishwasher. They want to know that pain level, or if you're able to do that. So yeah, I got approved. So you can do it too, people. So then in the middle of my divorce, I had the best insurance with my company that I owned, and I didn't know it at the time because I really didn't have money for legal representation. But after 2 years, Social Security automatically puts you on Medicare. Doesn't matter if you're 65 or whatever, because I was getting disability. Now, the only reason why I knew this is because all of a sudden, when I lived in Westmoreland County, I got a letter from my ex saying, oh, I'm taking you off the hospitalization. Well, I thought that was kind of crude since I owned the frickin' business. We were co-owners. I owned the business solely for like 30 some years, and then I started an LLC and gave him 50%. I should have given only 49. Yeah, but that's hindsight, people. So that's when I realized, why is he doing this? So I found out Social Security comes like almost automatic 2 years after you start receiving disability payments. So here we go. Get your pen and paper, or whatever, or you can just replay this video back, people. You can sign up for Medicare Part D. Now, I'm going to give you an instance, like, why do you need Part D? Well, here's one reason. I saved this for you guys. Totally unbelievable. This medicine is, for female things. I won't show you what it is, but it normally cost, what is it? $586, people, this medicine. If you have Part D, guess how much it costs? $11. Oh, let me see. $11. There it is, $11. That's why you need Part D, people. Yeah. Some medicines out there costing $2,000 and $3,000. You need Part D. Okay, and the number is 1-800-633-4227 or 1-800-Medicare. You can click enroll on the Medicare's website for Part D. Now, I know I'm going to skip around because I printed all this stuff out on my computer and on my printer. So everything's like out of order, but it doesn't matter. I think it might work out better for you because now you know about Part D. You can first sign up for Medicare Part D during your Medicare initial enrollment period, which is called IEP. Now, this is very important. Everything about Medicare is time-stamped. You have to do it in a timely manner. Your IEP lasts for 7 months, starting 3 months before you turn 65. Okay, I'm going to repeat that again. Your initial enrollment period for Part D, that's for your medication, lasts for 7 months, starting 3 months before you turn 65. So if my birthday is March, I would have had to sign up, December? About around December, I guess, or January, before I turned 65, and ending 3 months after the month you turn 65. So you've got a little bit of time before you turn 65 and a little time after. So you better mark your calendars if you are in this age bracket. You may also be able to enroll during the Medicare Advantage open enrollment period. Now, this is really getting technical, people. It's called the OEP. You can also enroll during the Medicare Advantage open enrollment period or the annual enrollment period for Medicare. Now, I believe that starts in October and maybe goes. So that is when a lot of you get bombarded with all these spam things, which I just got bombarded a minute ago. So that is another time. All right. Can I get a tax refund if my only income is Social Security? You would not be required to file a tax return, but you might want to file a return because even though you are not required to pay taxes on your Social Security, you may be able to get a refund of any money withheld from your paycheck for taxes. Now, I don't know about this because I have to file taxes on my income. I don't know about that one. I would put a question mark, not sure about that. Okay. The IRS looks at your total income to determine if your Social Security benefits are taxable. Okay, so here we go. It depends on your filing status. For an individual, if your total income is more than 25 grand, then you will have to pay taxes on your benefits. For a married couple filing jointly, part of your Social Security benefits are taxable if your total income is more than $32,000. If your only income is Social Security benefits and you get less than $25,000 in benefits, then you do not have to pay taxes on your benefits. Well, that's interesting. Okay. If you do not have any other source of income, then you would not need to file a tax return. Let's say, though, that your main source of income is Social Security benefits of $10,000. And you also work part-time job and you make $2,500 for the year. You would not be required to file a tax return, but you might want to file a return because even though you are not required to pay taxes on your Social Security, you may be able to get a refund of any money withheld from your paycheck from taxes. Okay. All right. I think I just did that one. All right. What is the 10-year rule for Social Security? The number of credits you need to receive retirement benefits depends on when you were born. If you were born in 1929 or later, you need 40 credits, which is 10 years of work. Now, sometimes in my life, especially when my kids were toddlers and when they were teenagers, I didn't work per se. I didn't get a paycheck. So it's a very important, if you are a sole proprietor and you're getting 1099s, that you do report that income and you have to pay like self-employment tax, because all that may go into your credits. And if you haven't really worked that much, your Social Security check may only be like $400 or $500, right? So you need those credits, people. If you stop working before you have enough credits to be eligible for benefits, the credits will remain on your Social Security record. Okay. When a husband dies, does his wife get his Social Security? Yes. These are examples of the benefits that survivors may receive. The surviving spouse, full retirement age or older, 100% of the deceased worker's benefit, you will get that. A member of my family is getting this. one of my, I think, cousins. Surviving spouse, age 60 through full retirement age, 71% to 99% of the deceased worker's basic amount. At what age is Social Security no longer taxed? Though there are some rumors on the internet that the government stops taxing Social Security benefits once you reach a certain age, which is such as 70. It's simply not true. Social Security payments are taxable from the moment you start receiving them until you die. Now, see, that's what I know, because I am taxed on my Social Security, and I'm 68. All right, now, we're going to talk about the A and the B. I won't go into that right now. So that I'm getting ahead of you guys. So we did talk about Part D, but Part C is a little bit more complicated. Okay. Now, Medicare is a federal health insurance program for people 65 and older, and with people with certain illnesses or disabilities. Now, that was me. That's where I fell into, because I was disabled. Medicare has 4 parts, A, B, C, and D. And then there's a lot of other letters, which we'll get into just yet. Part A covers when you're in the hospital as an inpatient, your nurse, your facility care, and hospice. If you are terminally ill or you know you're going to die soon, it will pay for your hospice. My sister, who I helped get her disability, she went into hospice, and for 2 weeks, it took 2 weeks for her to pass because she got off dialysis. Hospice came in and it was covered. Part A is free for most people. Now, Part B is what I use a lot lately for doctor visits. My regular GP, my gynecologist, my what is it called? Allergy doctor. All right. Part B covers the doctor visits, outpatient services, medical supplies. Sometimes I think it'll cover for maybe wheelchairs or a certain bed, but you need to check on that. And preventative services. Part B has a monthly premium as of 2023, but this goes up every year. Every year, it's not going to remain the same. It was $164.90 for Part B. Okay. Medicare covers more than 66 million people, and because a lot of us baby boomers are now of age, I'm sure that amount's going to go up. Some seniors are automatically enrolled in Part A. Okay. Now, is Part D deducted from your Social Security? Remember what we said Part D for is for medication. You don't pay the extra amount to your plan. Most people have the extra amount taken from their Social Security check. I never have to pay anything on A, B, or D because it's automatically broken down on my monthly disability. It's automatically taken out. You don't have to worry about that because they're going to get their money. If the amount isn't taken from your check, you'll get a bill from Medicare or the Railroad Retirement Board, and you must pay this amount to keep your Part D coverage. Now, one of my ex-husband's aunt, she got the Railroad Retirement Fund. Let me tell you, that is a nice fund. Okay. Now, if you want to, doesn't everyone get Medicare Part C? Now, this is where it starts getting complicated, people. Medicare Part C eligibility. To be eligible for Medicare Part C, you must be enrolled in Part A and B and a resident of the Medicare Advantage's planned service area. So when you start getting all this literature in the mail or these phone calls, first thing they're going to ask you is where you live. Certain plans only cover the area and you live. That's why it gets a little complicated. You must be a U.S. citizen or permanent legal resident for at least 5 consecutive years. Okay. What is the difference between Medicare Part C and Part D? What is covered under Medicare Part D? Well, you already know. A wide range of prescription drugs that people with Medicare take, including most drugs in certain protective classes, like drugs to treat cancer or HIV/AIDS. A plan's list of covered drugs is called a formulary. You're going to hear that a lot if you go to the pharmacy, because I worked in a pharmacy for 5 years. Plan's list of covered drugs is called a formulary, and each plan has its own. Now, here's where a lot of my customers would start cussing at me or at the pharmacist when the doctor or your prescription was not covered under Part D. It's not, it's the formulary. It's whoever your plan is with. And I think mine's with United Healthcare. Yeah. I have to pay for Part G. We'll get into that in a little bit. But whatever plan you choose, if they have a tier, they have a tier 1, a tier 2, or if the doctor doesn't, let's see, override, I forgot what it's called. They may not, the pharmacy may not pay for your medication, but so you'll have to go back to your doctor and say, hey, please tell my insurance company I really need this drug, and they may let you get the good price for it. But that causes a lot of confusion. I forgot the word for that. Because I now know what it's called, pre-authorization. Okay. So we're going to talk about Part C. All right. Here we go. Medicare Part C, also known as Medicare Advantage, MA, is a private insurance plan that offers coverage for inpatient care. That's not with the government. Part C is with the private company. Medicare Advantage is MA. Part C plans provides most of the coverage offered by Plan A, which is your hospital insurance, and Part B, which is your medical insurance. We already know what that is. I already went over that. They may also include extra benefits. Now, there's a lot of scams on the internet about this Medicare Advantage. They're saying, oh, you get a grocery thing and all that. Well, most of the time that is not true. It's not true. But you have to do the check yourself. Don't go by anything, on the TikTok or Facebook. You make the call. You do your research. So Part C may cover vision care, hearing care, dental care, home health care, hospice care, skilled nursing facility, care in religious non-medical health care institutions, routine dental care, including x-rays, exams, and dentures, and also cover Part D. Plan C plans may have a lower or higher out-of-pocket, but see, every plan is different, so you've got to do the math. Now, Part C plans may have lower or higher out-of-pocket costs for certain services. Part B covered services, you usually pay 20% of the Medicare-approved amount after you meet your deductible. This amount is called coinsurance. Like, I have to meet my deductible. It went up. I think it was 200 and something now. I think it's 250. It goes up every year. So mine is not going to be covered until I meet that deductible. And I just found out from my gynecologist that I can only see a gyno every 2 years. Medicare's not going to cover it in my situation. Some disadvantages. Actually, I think there's a lot of disadvantages of Medicare Advantage. This is Part C. A more limited choice of doctors. Now, this really gets people's goats. I can go to any doctor I want. But when you have Part C, depending on the health plan you got, you have a limited choice of doctors. than you would with original Medicare. Medicare Advantage plans can also cost more overall if you have complex medical needs. I can't afford Medicare Advantage. I can't afford Part C, by no means. These plans are best if you don't need expensive treatments or tests. Okay, now, this Medicare Advantage, remember I talked about pre-authorization? Here you go. This is about the Part C. Among the most commonly cited reasons are excessive prior authorization denial rates and slow payments. Okay. I think this is why some hospitals or some doctors or a lot of people don't like the Medicare Part C. Some systems have noticed that most Medicare Advantage carriers have faced allegations of billing fraud from the federal government and being probed by lawmakers over their high denial rates. So with Part C, I think that what they're trying to tell you is they've gotten in trouble for denying the pre-auths. It has become a game of delay, deny, that's what I just said, and not pay. Providers are going to have to get out of full risk capitation because, I don't know what that means. I think that's a spelling error, because it just doesn't work. You're at the bottom of the food chain and the food chain is not being fed. And this is what Chris Van Gorder, president and CEO of a San Diego-based Scripps Health said. Yeah, it says that the Medicare Advantage plans, among the most commonly cited reasons are excessive prior authorization denial rates and slow payments from insurers. Some systems have noticed that Medicare Advantage carriers have faced allegations of billing fraud. So that's why I don't like Medicare Advantage C. Hospitals are dropping this. Hospitals are dropping the Medicare Advantage plans left and right. Medicare Advantage provides health coverage to more than half of the nation's seniors, but a growing number of hospitals and health systems nationwide are pushing back and dropping some or all contracts with private plans altogether. I remember when I was working for Rite Aid and Walgreens that all of a sudden they don't take Blue Cross. It's because they have contractual obligations, and if those pharmacies like CVS or Walmart don't like it, they're going to drop it. So you have to be careful in your area which one to get, and if you like a certain pharmacy, you've got to make sure of who they're accepting. Okay. Can I drop my Medicare Advantage plan and go back to original Medicare? If you're in a Medicare Advantage plan with or without drug coverage, you can switch to another Medicare Advantage plan with or without drug coverage. Okay, I think I just said that. You can drop your Medicare Advantage plan and return to original Medicare. Well, that's good to know, isn't it? Now, let's see. We're going to get... Here are some important facts before starting Medicare. You might be able to get Medicare earlier if you have a disability. We already went over that at the beginning of this video. If you have end-stage renal disease or ALS. Now, I got my disability because I had everything that you could have wrong with your back, I had wrong. And my sister ended up having end-stage renal disease. Medicare has relatively high deductibles and cost-sharing requirements. Medicare only covers 80% of eligible medical expenses. Now, remember what I just said, that's 80%. So if you have something catastrophic happen to you and you're in the hospital for a month or two, you're going to have to pay that. So that's why I went and researched and got Plan G, okay? Medicare doesn't cover long-term care, most dental care, eye exams, cosmetic surgery, massages, hearing aids. And you could pay more if you would enroll late. Remember, I said everything's got to be done in a timely manner. Okay. You can sign up for Medicare when you apply for Social Security 3 months. I already said that. Before you turn 65 or later. The initial enrollment period is 7 months long. Remember, I said there was a couple months before and some months after. Starting 3 months before you turn 65 and ending 3 months after the month you turn 65. Medicare has a cost. You have to pay for it. It is not free. And people who aren't eligible for free Part A can pay a monthly premium of several $100s. Medicare benefits don't pay for everything after you meet your deductible. Remember, I told you I had to meet my deductible every year, and it does go up every year. In many cases, you can only use doctors and other providers who are in your plan's network and service area. Now, I think I used to have Plan M or N or something, and I didn't like it. I want to, if I'm sick or whatever, I want to be able to go in there and know once I pay my deductible, no matter what I'm in the hospital for, my other plan that I pay $122.76 a month is going to cover that. Now, I wanted to drop it because my funds are very limited, but my friend said, no, Debbie, if something was to happen to you, you would lose everything. I would lose my car, my house, everything. She says, keep your Plan G. Now, Plan G covers Part A deductible, hospital costs, Part B copays, excess charges, and coinsurance, and it doesn't cover the Part B deductible. So even though I have Plan G, I still got to meet a deductible like on doctor visits, okay? Plan G is a secondary coverage that fills the gaps in Medicare, such as deductibles, coinsurance, and copays. So my Plan G will cover everything except the deductible for Plan A and B. It's a good option for people who want some hospitalization coverage but are willing to pay the Part B deductible themselves. Plan C and F aren't available to people who turn 65 on or after January 1st, 2020, and some people under age 65. However, you might be able to get these plans if you were eligible for Medicare before January 1st, 2020, but not yet enrolled. So please, if you have a question, go under Google. No, there's no such thing as a silly question. Go under Google and Google the answer, and artificial intelligence will probably answer it. But let me tell you what, I have spent many days and hours on the phone with Social Security. You really need to call them, and usually you'll be on hold for hours, but you can put in your phone number and they'll call you back. Write down in a log who you talked to and the time that they called or you called and the date. And I guarantee you, this has happened to me many times, you're going to get a different answer to your question, because I was on the trial work period, because you're able to work if you're disabled. It's actually a Disabilities Act, right? But we're limited to how much we can make. So I always had to make sure, I think I could only work 4 or 5 hours a day, maybe 5 days a week. I couldn't go over a certain amount. Now, when you're on the trial work period, you can Google that. That's also very complicated. You're allowed to be on it for so many years, and I went online and gave them the breakdown of my paychecks. I also, to cover my elbow, because you don't want to piss off the government. Sorry about that word. I also sent in copies, certified return receipt requested. Now let me tell you what, can you guess what happened? They were adding up what I put online in it's called My Social Security. They always make you do a 2-factor authorization. They totaled that up and they said, you're being audited. You're making too much money. I said, are you guys dense? Are you stupid? I just entered it online in case you never got the paper, the copy of my paycheck stub. I said, if you see the dates are the same, the amounts are the same. I was audited. The paperwork was tremendous. So yeah, you're going to be inundated if you're under the trial work period. So only enter those amounts. I would say just do it online. But yeah, I was audited and I was getting in trouble. Now,